Good evening, everybody. My name is Dr. George Iskander. I'm trying to make a video about my theory about staying at home testing for coronavirus. I've been trying to promote stay at home testing for a couple of points. Point number one is by the numbers, most of the coronavirus patient actually can be treated at home without needing to go to the hospital. And number two, looking at the huge number of patient that goes to the waiting online and in the street to go into the hospital, I think that increased the risk for transmission for coronavirus. And I think also they can come to the hospital actually with a negative coronavirus test and turn to be positive inside the hospital. And also, I think that it also overwhelmed the healthcare system. So I'm gonna go over my algorithm for staying at home testing. Apologize, I'm on call. So there's all sort of noise behind me, but this is my algorithm. So uh, stay at home. That's the key principle. Stay at home. So I think what should happen if a patient start or any kind of person staying at home start developing any sort of symptoms. So symptoms are dry cough, having a fever, or being exposed to a known COVID-19 patient. This patient should be either call the number for your state or go online to the CDC website or to an app and trigger a signal. Okay, so that signal has one of two things. A telemedicine call with a provider, or if the symptoms are actually more alarming, we send them a testing kit through, could be Amazon Prime or through UPS, something that actually deliver the kit to their houses. It deliver it to their house and it deliver it fast. So the key here is fast, because once people think or know that they have a known coronavirus patient or being exposed to a COVID-19 patient, what ends up happening is people start having an anxiety and start panicking, and they really want to just see a provider immediately. And sometimes seeing the provider going to get tested as has more side effect and more dangerous than actually staying at home. So we will talk about the testing kit. So my idea about the testing kit, it has to be number one in a box, and outside the box should have a sanitizer and should actually also have gloves to open the testing kit. Number two, that box will be having the testing kit, which is really just a swab technically that anybody can do at home. Number C, it should have a brochure. And inside that brochure, you should have two things. Number one, how to perform the test. How to perform the test. And number two, what to do. What to do until the test results comes back. Now there are a lot of kind of test that comes back in 3 days, test that comes back in 6 hours, test that comes back and gets sent away if you are in a small city. But the reality is the test actually can take up to 72 hours, has to have a special temperature and a special container and media to be transferred for a viral test. Until the results comes back, people just need reassurance that they will be okay at home. So to make sure that they get the reassurance that they need at home, I propose three things. So number one, a thermometer. So basically they can track their temperature to know if they're having a fever or not. A pulse ox, for you who doesn't know what pulse ox is, it's a way that we measure the oxygen saturation and basically tell you that your oxygenation okay, because what people hear most of the time, it's hard to breathe, and they are super worried that they're not breathing, that their oxygen saturation is dropping. So the pulse ox will take care of this part. And number three, a way to telemedicine. Now this is a key. Telemedicine is a key in these kind of situations. Again, to avoid panicking, if you have a slight degree of temperature, slight drop in your oxygen saturation, the fact that you have connectivity to telemedicine somehow, like if your pulse ox drop below the normal saturation for the human being is 100%, but if your oxygen saturation drops down to an alarming level, which is 90%, or your fever is creeping up to 101 and above, then that trigger automatically is connected through some sort of app or some sort of follow up with the telemedicine to trigger a telemedicine. We're not waiting for you to tell us you have a problem. We are actually waiting for the thermometer or the pulse ox to tell us that there's an issue. So that trigger a telemedicine call. Now that give you the reassurance that even though you are not seen immediately, you will be seen if your clinical presentation worsen. And by doing this, we're decreasing the amount of people that are actually going outside to get tested, or if you are positive, and instead of you taking your infection to the hospital, to the people that you're waiting online uh, to be tested, and to the healthcare people, you basically, even if you are negative, you're staying home. Even if you're positive, you're still staying home. You're quarantining at home, and again, most of this infection you can recover from, and you can recover from them at home without needing to go to the hospital, unless if you have a severe condition. Now, the that's what you're gonna do until you actually get the test results. Now, if you do have if your test results comes back positive, again, if your test results is positive, okay, again, the whole idea, you don't have to leave, you don't have to get the other people infected. So what you're gonna do is you are gonna just follow up your fever curve, and that will be supplied to you in the testing box. So it's a little chart that tells you today is March 29. This is your temperature, and you do that twice a day. That's exactly how we do it in the hospital. This is March 30th. You do measure your temperature twice a day. And that fever curve actually tells you and tells your provider how well are you doing in the hospital. I'm sorry, when you are staying at home. Also, we have your pulse ox. So your oxygen saturation, you will take that twice a day. Again, it goes over the day, tells you how are you doing at home. That kind of gives you the reassurance that even though you're staying at home, you still are safe and you still are staying at home, quarantining at home. Now, God forbid if your fever curve actually creeps up and goes to the dangerous levels, 101 and above. Again, the normal temperature is a 98, but we only really worried if your temperature creeps up above 100.4, and we are start worrying when your temperature is 101. Okay? Okay. Now for the pulse ox, if your oxygen saturation drop below 90. Okay, so now we are start to getting worried about you. Now that actually these two criteria together, okay, trigger an ambulance sent to you. Now it has to be an ambulance or a first responder for a reason, because now we are thinking that you do have a positive corona test and you are in that 15% that can actually get sick. Now we're saying 85 actually recover at home with no problems, 15% can get sick, only 5% gets really, really sick, and 2 to 3% dies. Okay, so if you are in that 15% that might get really sick, you should trigger an ambulance because we know it's a severe strain, and we should have sent you first responders that actually have their own PPE. Plus, we actually it triggers a cleaning and disinfecting that comes to you. Uh, and that way we can complete your testing, we can complete everything, and you should be on a ventilator. So this is my stay at home algorithm. I hope this can help somebody, and I hope it can save some lives. Thank you.